Good evening. Thanks very much for joining us. Let's start with the daily coronavirus count. The daily case count has dropped below 40,000 for the first time in 5 days, but test positivity rate inches marginally higher. Kerala is reporting the most number of infections with over 12,200 cases in the last 24 hours. It is the only state to record more than 10,000 cases in a day. According to the Health Ministry, Kerala has 14 districts of concern as of the 9th of July. A district of concern is one with test positivity rates of over 10%. Maharashtra is home to 15 districts of concern. Tamil Nadu, Andhra Pradesh and Orissa have over 8 districts with the positivity rate in double digits. Northeastern states are also seeing a rise in infection, with 4 states reporting a test positivity rate of over 10%. Sikkim has a positivity rate of 20%. Meanwhile, the overall death toll has once again fallen below 800, with 724 deaths being reported in the last 24 hours. The decline comes after the country has seen over 1,200 deaths on Saturday. Maharashtra and Kerala have seen the highest number of deaths, followed by Tamil Nadu and some northeastern states. Now, that's the picture as far as coronavirus is concerned. Let's talk about vaccines. India has administered nearly 29 lakh vaccine doses as of 4 p.m. today, but the pace of vaccination has been dropping over the last 3 weeks. The 7-day average vaccination rate stood at 33 lakh on the 21st of June when India entered into a new phase in the inoculation drive. This was when the central government started to procure and distribute vaccines to states all over again. Now, the first week, starting the 21st of June, saw the 7-day average hit a high of 60 lakh. But since then, it has declined. And as of yesterday, we're back to the 33 lakh level last seen before the 21st of June. Many cities are again running out of vaccines. Delhi has said it only has a day's stock available. Maharashtra had suspended its vaccine drive at some centres due to a shortage of doses. And today, the BMC has restarted the vaccine process. So what exactly is the reason behind the sharp fall in vaccination and the shortages of doses at government centres? Here's one visible trend. While the government has chosen to allocate 25% of available vaccines to private centres, a majority of Indians prefer to get vaccinated for free at government centres. Remember, at private centres, you have to pay to get vaccinated. Some states have asked the centre to cut that 25% quota for private centres and instead provide that to government facilities. Archana is standing by now to explain how vaccine inequity could be hampering the inoculation drive. Archana.
Well, yes, since the May 1st, when vaccination was opened up for everyone above the age of 18 and for private procurement as well, we have seen disruptions in state-run vaccination drives. Mumbai, Delhi, Gujarat, Tamil Nadu, you highlighted, those are some of the recent examples, and there have been most states who have been questioning that they are only getting supplies worth 1 or 2 days to run the vaccination drives. In the meantime, however, private centers have been operational throughout since May 1st, and there has been no disruptions. Now, there are clearly 2 reasons for the disparity there. One, the production of vaccines is lower than the offtake and the demand. Now, we know, and the government has been intimating that they have increased production of vaccines, and the vaccine intake has gone up. But we've seen a clear trend from June 21st, where the average inoculations have dropped down from as high as 80 lakhs a day to as down as 35 lakhs on an average on a daily basis. And 2 is that a majority of people in India prefer to go to government centers to get themselves vaccinated versus going to private centers where they have to pay for the vaccines. There have been multiple reports of unused vaccine stocks at private centers, highlighting the citizen preferences. While most states do not give a breakup between government centers and private when it comes to vaccination numbers, abysmal performance have been highlighted by some of the states. Case in point, Chhattisgarh. Less than 0.5% doses, total 32 lakh doses that have been administered between May 1st and July 5th in the state of Chhattisgarh have been done by the private centers, less than 0.5%. In Tamil Nadu, the private sector accounts for just under 5% of vaccine doses being administered. Mumbai possibly is one city that has close to 40% of vaccination being done at the private sector, and that's quite a high number. None of the states and the cities report as high a private sector involvement. Now, most states and many states are highlighting that while private sector is not able to use up the stock, those stocks should be given to the state government centers, because they are the ones that are giving it out at free for all segments of the society. Rajasthan Health Minister told CNBC-TV18 that they had written to the former Health Minister Harshvardhan last week stating that the private sector quota should be given to the state and the state will be utilizing that. The reason they have indicated that is because they say that the private sector uptake is negligible. Two, in the month of July, 48 lakh doses roughly is being allocated for the state government centers and the government centers. However, the requirement just for administering second dose commitment is of 75 lakh doses. Now, about 16 lakh doses go to the private center, and Rajasthan Health Minister says if that also comes into the government kitty, it will be a much easier drive. But at this point, when there is shortage of vaccines at the government center and enough vaccines at private centers, we have seen senior government officials call out people and urge them and encourage them to go use private sector vaccination. Case in point, VK Paul in Friday press briefing called out people and said that vaccine availability in private sector should also be utilized. Now, that experts say that insistence to lean on private sector could lead to a lot of vaccine inequity. We've already reported in the past that majority of vaccines between May 1st and May 31st had gone to only some of the private centers, and that too in urban areas. So the rural areas get left out. Even for WHO, vaccine inequity is a big issue, and this should be looked into. Back to you.
So I urge that the vaccine availability in the private sector should be utilized optimally. We should look at that channel of availability also, because there may be vaccine on that side being available, and we should encourage people, and we should also help people to receive vaccines.
Well, that's the head of the COVID task force, VK Paul, saying that people should make use of the vaccines that are available across private sector. But the problem there is that it is paid for, and that is proving to be a challenge or a deterrent for a large number of people. Joining us now to take the discussion forward about where we currently stand, both with COVID-19 and the spread of the virus, as well as vaccination, Anish TS, member of Kerala's COVID expert committee. Also with us is Dr. Deep Kumar Debarma, Program Officer of Tripura's Integrated Disease Surveillance Program. He's the nodal officer for COVID-19 in the state. And Dr. Shashank Joshi, member of Maharashtra's COVID task force. He's also a consultant endocrinologist at Mumbai's Lilavati Hospital. Doctors, appreciate you joining us here on the program. Dr. Debarma, let me start by asking you, because tomorrow at 11, the Prime Minister is going to be holding a meeting with chief ministers of northeastern states. The northeast has been a region in specific focus on account of the spike in infections. Let me start by asking you about Tripura and where things currently stand as far as Tripura is concerned. Curbs have been brought back in. There is now a total weekend curfew that has been announced, a positivity rate of almost 7% on a daily basis. Can you take us through what exactly is going on ground? You're on mute, sir.
Actually, the positivity of the state of